If you've been told you need surgery for an ingrown toenail, that isn't always true. In many cases, especially early on, non-surgical treatment can settle the pain completely. The key is knowing when conservative care is appropriate and when it's unlikely to work. I'm Dr. Damien Lafferty, a surgical podiatrist, and today I want to explain when non-surgical treatment for ingrown toenails is effective and when it is not. An ingrown toenail occurs when the edge of the nail plate presses into or penetrates the surrounding skin. This causes pressure, inflammation, and in some cases infection. Early ingrown toenails are usually driven by mechanical factors. These include improper nail trimming, tight footwear, minor trauma, and natural nail curvature. At this stage, the problem is often mechanical rather than permanent structural change. That's why non-surgical treatment can be very effective early on. In early infection, drainage, removal of the nail spacule, and elevation of the nail edge are often more important than antibiotics. Antibiotics should be reserved for more severe infections, spreading cellulitis, or systemic symptoms. Repeated courses of antibiotics without correcting nail mechanics often delay appropriate treatment and can lead to additional complications. There are situations where non-surgical treatment is unlikely to succeed. This includes cases in which the nail repeatedly regrows into the skin, in which hypergranulation tissue is well established, in which the nail matrix produces a permanently curved or thickened nail, or in which the condition has been present for many months or years. At this point, continuing conservative care can prolong pain and frustration. The special care is required in higher risk patients. In people with diabetes, peripheral vascular disease, neuropathy, or immunosuppression, early conservative intervention is essential to prevent complications. However, prolonged infection or recurrent inflammation increases the risk of ulceration. Therefore, thresholds for escalation should be lower. If symptoms persist despite well-applied non-surgical treatment, escalation should be considered. This does not represent failure. It means recognizing when the nail's biology has changed. When performed properly, surgical correction can provide permanent relief and often results in less overall trauma than repeated unsuccessful conservative care. Non-surgical treatments for ingrown toenails can be highly effective when used at the appropriate time and for the appropriate patient. They aim to reduce pressure, control infection, and allow the nail to grow normally. I commonly see patients who have undergone multiple failed attempts elsewhere and are frustrated that they weren't referred earlier. If conservative care works, that's ideal. If it doesn't, persisting indefinitely often makes the eventual treatment more complex. This reflects my clinical experience developed over many years of training and practice. If you'd like to learn more about related treatments, I've created additional videos that go into more detail. You'll find them linked below or in the pinned comment. If you found this helpful, please like the video and follow the page or subscribe to the channel for more practical, evidence-based insights into foot and ankle care.